A new global report warns of an alarming surge in childhood measles cases. 98 countries reported a rise in cases last year, including some where measles had once been eliminated. In the first 2 months of this year, nearly 200 cases have been reported in outbreaks in 5 states across the U.S., mostly among children who were not vaccinated. Dr. Jon LaPook visited Texas, where the outbreak has ignited a statewide debate.
In Texas, the fight over vaccination requirements isn't just a health issue, it's political. State Representative Jonathan Stickland, a Republican, says while he is not against immunizations, he opposes any legislation related to vaccine compliance.
I always come down on the side of parental rights and individual liberty.
What happens when parental rights brush up against the rights of children to be protected from potentially deadly childhood illnesses?
The state does not own our children. Parents are the ones that are tasked with making those decisions.
Texas has more than 56,000 children with non-medical exemptions for reasons of conscience. A decade ago, it was 10,000. Legislative efforts to eliminate the exemption failed after pressure from anti-vaccine groups.
The anti-vax group have become very, very politically engaged.
Republican Representative Sarah Davis says even more modest bills, like improving vaccine reporting, failed to advance.
They literally will drive in from all across the state and campaign very heavily against anyone that they think stands in the way of their, I believe, anti-science, anti-vaccine agenda.
What's going on when you have these discussions with your fellow legislators? What's the objections?
The objections is that it's just a controversial vote. You know, we're creating an issue. It's easier just to ignore it.
What you are doing right now is throwing gas on your enemy's movement. These people were not motivated to be involved politically before you tried to shove it down their throats with government mandates.
Infectious diseases expert Dr. Peter Hotez tracks the vaccine landscape.
This is a self-inflicted wound. We allowed the anti-vaccine lobby to rule the internet, social media, and political action committees. We didn't stand up to them, and unfortunately the state legislators, they caved.
Until we have what I would just say average Texans standing up and saying enough is enough, I want to see our vaccine levels increase, then we're only going to get worse.
As the fight here continues, caught in the middle are the children. Dr. Jon LaPook, CBS News, Austin, Texas.